Hey, welcome. So today we're going to talk about something really important, depression. We're going to get into what it feels like, how it's actually understood, and maybe most importantly, the real practical steps you can take to start feeling better. Let's kick things off with a feeling that I think a lot of people can relate to.
This just gets right to the heart of it, doesn't it? That feeling of a hidden struggle. It's such a perfect way to describe an experience that can feel incredibly isolating, making you think you have to somehow manage it all on your own. And when you're carrying that unseen weight, the idea of opening up about it can feel, well, almost impossible. There's this pressure we all feel, especially in certain environments, to always look like we have everything figured out.
Yeah, the pressure to be constantly on, to be put together, it just adds this whole other layer of difficulty, right? It can make admitting you're having a hard time feel like you're somehow failing, when honestly, it's a sign of incredible strength.
So, what does this struggle actually look and feel like? It's so important to understand that depression is way more than just feeling sad for a little while. It's a much more persistent thing, and it can show up in a whole range of different ways.
And these feelings can look so different from person to person. It's not just one thing. For you, it might be this deep fatigue you just can't shake. For someone else, it's a feeling of being totally numb, or maybe losing interest in the hobbies you used to absolutely love. Just recognizing how varied it can be is a huge first step.
Okay, this table, I think this is super helpful because it connects those everyday feelings to the more formal terms. And seeing that things like burnout or feeling inadequate are recognized, understood conditions, that can be so incredibly validating. It means you're not making it up and that there are proven ways to help.
And that's the thing, right? These signs get missed all the time. It is so easy to just brush off being irritable or exhausted as, oh, it's just stress from my job. But these can absolutely be key signs that something deeper is going on.
All right, so if any of this is sounding familiar, what can you actually do? Let's demystify what therapy is really all about by looking at a few proven approaches. I like to think of these as different tools in your toolkit for recovery.
First up is CBT, which is a really practical, hands-on approach. You can almost think of it as a workout for your brain. It helps you spot those negative thought loops we all get stuck in and gives you actual tools to challenge them. The idea is, if you can change how you think, you can change how you feel.
Then you've got IPT. Our relationships are such a massive part of our mental well-being. This one is kind of like relationship coaching for your mental health. It really zeroes in on your connections with other people, helping you communicate better and turning those relationships into a real source of support.
MBCT offers this incredible blend of techniques. It takes the practical stuff from CBT and mixes it with mindfulness. It teaches you how to become an observer of your thoughts, like watching cars drive by, instead of getting stuck in traffic with them. It helps you see them from a distance, so they don't sweep you away.
And finally, there's ACT. This one is all about making a big shift in how you relate to tough emotions. Think of ACT as your life's compass. Instead of constantly fighting painful feelings, you learn to kind of let them be there, while you focus your energy on doing things that truly matter to you. It helps you move toward a meaningful life, even when the emotional waters are choppy.
Okay, let's dive into some of the real talk questions you probably have about starting this whole journey. It is completely normal to have questions, to have hesitations, before taking that first step.
So, first big question. Does therapy actually work for depression? The answer is a huge, resounding yes. Tons of scientific studies have shown that talk therapy is a highly effective way to treat depression. Not only does it help you feel better now, it gives you skills to help prevent a relapse down the road.
What about a diagnosis? Do you need one to start? Absolutely not. You don't need any official label. Just feeling off or overwhelmed or knowing deep down that something isn't right, that is more than enough reason to get support. Therapy is for anyone who wants to feel better.
Okay, what about privacy? Is therapy confidential? 100%. Confidentiality is the bedrock of therapy. Everything you talk about is private, it's protected. It is a safe space for you to share without worrying. The only exception is in very rare cases where there's a serious risk of harm, and that's just to make sure everyone stays safe.
And what if you start to feel better? Can you stop? Of course, you are always in the driver's seat of your own journey. If you feel like you've gotten what you came for, you can decide to stop or maybe just go less often. It is completely up to you.
Taking that first step can really feel like the hardest part, but it's so important to try and reframe it. Seeking help is not admitting defeat. It's a powerful, proactive move you're making to take care of yourself and get back to feeling like you.
And you know, the actual process is usually way simpler than we build it up to be in our heads. It really just starts with one thing: booking that first conversation. From there, you just share what's going on in a safe space, and then you work together to figure out a path forward that feels right for you.
So I'll just leave you with this one thought. We often build these things up in our minds to be these massive, scary mountains we have to climb. But what if the first step, the very beginning of lifting that unseen weight, was just one simple conversation? Thanks so much for joining me.